Hello, everybody. Welcome. My name is Paul Preobrazhensky. I am the New South Wales State Branch President, and I'm hoping to just give you a bit of an overview of what the HMIP is, to support you in your application, to help you frame up what we're looking for in applicants for the HMIP. And to just give you the nuts and bolts of what actually happens when you sign up for 2 years of your life in management development. So just quickly, I wanted to sort of ask you a question, if you don't mind. It's great interest to us as to who you are and where you come from. So I would like to ask you firstly where you're from. So you can see I've just launched a poll up there on the screen to show a few different locations. And I was wondering if you could just click on the location that you are in so I can get a bit of a feel for what kind of a placement you're looking or where you're looking for a placement. If you have trouble with using the poll, just click on type it in the chat message. So you'll see chat message in your bar either above or below. And if you can't see chat, it's probably in the more section. So click on more and go to chat. Ask any questions as you go through this session. Okay, so looks like you're all from the Sydney and surrounds area. That's great. A lot of our Sydney and surrounds are where our placements are. However, there are placements in regional areas in New South Wales, and there are opportunities both north and south in our regional areas. Being a strong advocate for this, I would highly recommend to get a broad and diverse experience in a flat organisation if you chose to pursue a rural placement. Now, I have another question for you, if you are able to participate. I wanted to know a little bit about where you're at in your career. What stage are you in? Are you beginning? Are you in second year? Are you a clinician looking for a stepping up? Are you a manager looking to employ an intern? Or are you looking for a place to place an intern? If you are any of those, I'd be really grateful if you could answer that question for me. Okay, so undergraduate degrees, good to know. A lot of participants in our program are undergraduate degree participants and have been looking for that opportunity to find a way to transition from the university life into a health service manager's job, which is clearly something that the program has been doing significantly over the years. But in addition, there are many people who have taken on this program as a clinician as a way to step up. And I can tell you that it is a fantastic way to step up as well. Bit of history, back in the early 70s, the program commenced, and it commenced at Hornsby Hospital. It has been running ever since. It's one of the few, if the only program like this that offers work placement, education, mentoring and coaching to identify and develop people in their careers, regardless if it's university or whether it's clinical. I can tell you sometime between the 1970s and today, I did the management placement program and I did my 2 years, and I can absolutely guarantee you that as a clinician, it was something that helped me step up and made me into a proper manager. So yeah, good luck to you if that's your choice. Bring your clinical hat, but think management. It's the right way to go forward in this program. So let me get into it. This program, it aims to provide qualified trained graduates at the entry-level management area. So it gives you the management skill you need to be in that management role. Now, management skill is a unique skill. It doesn't come from an experience in healthcare. You can learn some of it from a degree, but you actually need a little bit more, if you ask me. You need the peers around you to help you understand what management's about. You need some insight, you need some immersion, you need to see people working as managers to help understand what they really do. You can read in a textbook lots of management styles, and they are great references and resources. But making that transition into the role is about what we do. As a college, that's the main thing that we do. We look for providing management development support and coaching and mentoring to anyone who is looking at management or who is in management and wants to continue to develop their skills. It's a structured program. It provides the degree that you may want to do if you're doing a management career in health, and it also provides with experience on the job. And I've got to say that this is a program where you don't cruise along. You are in the job and you are actually working. You are contributing to healthcare from day one. What we want as the college is to make sure that we get the best people into management. We attract the highest quality people into management. We support them and they sustain good management across our system. And of course, that leads to healthier communities and better outcomes. It can mean that you can be an existing employee of a health service and go on to this management program after assessment and a successful interview and be paid to do your management program inside your own organisation. Some places do that. One place is Mid-North Coast Area Health Service. They have people who interview, are assessed, and when they're successful can go back and to work in their own home district or home hospitals and do rotations and gain management experience in that way. It's also a pathway for Aboriginals and Torres Strait Islanders. What we will do is create and tailor a unique program. We'll find you the right coaches, the right mentors, and the right placement that will put you with people who are like you, who have had Aboriginal experience or Aboriginal community experience and can help you step up. One of the great things about this program is the network of people that you do it with. There is 10 to 20 other people who are exactly the same position, who are looking to step up or make a transition into health service management. And while you may not be working in the same buildings or in the same hospitals or the same districts, you may not even be working in the same states. There is a strong bond that develops, and the sharing of knowledge is invaluable to your experience and to your development. We use a strong capability management standard. We assess you where you are now, and you can use that tool for the rest of your career to assess how well you're going in developing your management skills. It all starts here in this HMIP and keeps going. I'm a manager of 25 years and I still work in the field. I continue to use the competency standards to see how well I'm doing, to see what I need to work on next, to see what I thought I knew, but now I actually don't. I'll show you a bit of that in the future. And I've already mentioned the degree that we offer you. There is a master's degree, and that master's degree is paid for by your employer. I suppose that's a really important carrot for anyone who wants to get into this program, and that's why it is so popular. The degree is currently offered by the New England University. And the atmosphere, the college life, the ability to link up with people who want to support you is an enormous asset. Like I said, I joined the college when I did the management training program a few years ago. Sonia probably knows how long ago it was. It probably slipped out in one of my classes that she sat in. And I am still in the college. In fact, I'm so in the college, I'm the president of the New South Wales branch. So it builds collegiality, and it actually offers you something that you want to continue to contribute to and give back to those people who are now learning the management trade. And for us, it is best practice. This is the best way to do a transition into health service management. So to get into the program, the important parts, you've got to have a degree in a related field. So reasonably related can be anything in healthcare, as you may well be aware. It can be a law degree with health interests. It can be a nursing, a medical, a science degree, a health science degree, a recreational therapy degree, occupational, you name it. As long as it's related and it's a degree and you have completed that successfully, you are eligible. And of course, you have to be an Australian citizen. We are looking for the best out there, and we regularly get large numbers who apply. So it is desirable to have a year or two experience in a work-related field. those people do have an advantage. However, you are not excluded if you are applying as a direct graduate. You do need to be impressive. You do need to have a good grade and to be able to demonstrate to us in the assessment and interview that you are meritorious, let me say. And their achievements or their scholarships or their past high distinctions in my subjects might help, you know. I'm joking. Okay, welcome, Burlas, who just joined us. Now, the internship structure, okay, this is important. Now, there is some variation here, but this is generally the structure that we use. It's 2 years of on-the-job work to have health-related public or private sector experience. So you must do that. You must complete 2 years of experiential learning on the job to graduate from this program. You must complete your master's, and that is within 2 years. So, look, we can't understate that this is a hard job. This is no walk in the park. You are learning new skills every day from experienced managers, and you're also doing a master's degree in health service management. Don't underestimate that. It's external study, it's 6 units per year, and of course you do that by doing this program. You get some credit for what you're doing in workplace. Of course, because you are doing an experiential learning and you're doing a degree in the same subject area, there is crossover, and you can use your workplace to find those resources that you need for your assignments. And of course, all the people that I mentor, I constantly encourage them to find benefits in their university that they can use in their workplace. It always adds value for you, adds value for your workplace. There is a professional development component that is facilitated by the College of Health Service Managers. It is done as a group, and it creates that network. So you actually have and are required to attend, unless there's extenuating circumstances, the orientation professional development days, which I think, and I may be wrong, but don't worry too much about it, is 8 a year. And you have to do the ACHF events. You have to participate in the mentoring program, of which I am a mentor. You have to be a member of the college. And there are options for you to represent younger managers and emerging managers on the State Branch Council with me. So you can then play a role in the governing voice of the college, not only for your program in New South Wales, but for the professional development of all other managers that we work through as a New South Wales branch. And that's commonly known as the council. There are placements all over the place. I've got a list here. There's private, there's aged care, there's disability, there's clinical excellence, there's policy and quality development in there, there's government in Ministry of Health, there's independent hospital pricing authority in activity-based management, and there is local health districts, which are the large structures of New South Wales Health. There may be different ones, there may be more coming up. We've recently reached out to some new participants, and so therefore you may have great opportunities in the coming year to go to new areas that will immerse you into a field that is growing, such as aged care. And they change year to year. You know, every organisation's finances change, their needs change. So some people come and go. There's lots of organisations who still employ the graduates, who still value these graduates. And I suppose it's worth saying just here, while you work hard, while you get a lot out of it, you will get a lot out of this. The name of a graduate from this program is highly reputable. People will want to employ you. In fact, our graduate employee rate is exceptional. In fact, 100%. You've virtually got to not want to work in healthcare to not get a job in healthcare after you've done this program. So what kind of work do people do? There is work often alongside of chief executive officers. You will get exposure to the most senior people. You will work alongside them. You'll do their work in terms of writing policy, doing research, doing critical analysis, doing their ministerial correspondence, writing responses to complaint letters, being involved in meetings at the highest level. You will be doing the notes, but you will see meetings at the highest level. You will work in operations. You will work with directors of patient flow and operational directors who actually create strategies every year to meet the demands across our health system. You will work in things like a workplace culture improvement. You will do special projects that are defined that you will be able to put on your resume to say, hey, I did the organ and tissue donation governance group. I managed that. We enhanced the way that we manage organ and tissue donation donorship in our local health district. You'll get opportunities to do those core foundations like finance. Finance is one of those things which we all need to know. Managing people, big one. Knowing your finances, also a big one. You'll get to look at activity-based management, management of DRGs, look at how we fund and finance our health services, negotiate budget build-ups, all of the things that you may have not listened to when you did my finance subject, but you will actually have to do, and they will be then become ingrained. If you can't tell, the things that I teach are the things that I do in my work life as well. So it's crucial that you get these experiences. They're all offered in these placements. There's work in lots of regional districts. You'll get to travel around your district. You'll get to work with pillars, developing work groups to do innovation. You'll get to do with work groups to look at quality improvements, depending on where you're placed. You'll get an understanding of integration with primary care. You'll get an understanding of how community health fits within the picture. You'll get a broad spectrum of exposure in this system. And I've got to say, you're working with people who can make things happen for you. If you go into an organisation and your first placement is with the Director of Finance and your your placement facilitator, you have a conversation, you'll make a plan. If you say, hey, I need to develop my skills in workforce management, I need to develop my skills in finance, I need to develop my skills in activity-based management, these people will definitely be able to help you get the exposure. It may not be a full placement, but it will certainly be a part of your placement to what your needs are. We'll help you get there. We'll help you understand what your needs are through the program. Then the conversation is with you and your supervisor to make the most out of it. So you can get an enormous amount out of this with your placement supervisor and with the college's support. The Masters of Health Administration, covers all of the things that you will need to become a good, competent, and that's a framework term, manager. Social determinants of health, managing human resources, a good understanding of the Australian healthcare system. You've probably all done a degree and you think you understand the Australian healthcare system. I can tell you there's more to learn. It's one of the competencies that I continue to learn. I did a tour last week and spent a whole week with 30 doctors from Thailand. I helped them try and understand the Australian healthcare system so that they can get some takeaways from the Australian healthcare system to take back to Thailand. I realised last week that I'm still learning. I still need the competency frameworks. I still need to work on understanding the Australian healthcare system, even though I teach it. There's integrated health, there's policy and planning, there's health law and ethics, there's international comparisons, there's policy analysis, and really importantly, quality in healthcare, that you can't do without quality in healthcare. So what you're required to do, you're required to rotate through various parts. I hope you've picked that up already. It's not one placement. Even if you're working with a home placement, we need you to rotate through different environments, to work with different managers, see different skill sets, understand different components of healthcare. We need to have a development plan, a personal development plan. Some of you may have done a personal development plan in your HR or workforce management subjects in the past. This is one for you that you're actually going to have to deliver on, one that you're actually going to get something out of. It's not like a uni subject. It's tangible, it's feasible, it's what you need to know. And this is what the college helps you with. So you need to self-assess yourself against the competencies. And if you think you've gained something in one competency and you're lacking in another now, you create a new professional development plan. You'll meet with your supervisor, as I said, you'll discuss those and you'll submit a report on the attributes, and the supervisor will help you deliver a report on the attributes that you've demonstrated and the attributes you still need to work on. A third party is always helpful. So the competency framework works like this, and this is what we want you to get. We want you to come out with a good basic competency and basic competency is the first level of all these areas in healthcare: leadership, healthcare and the environment, business skills, really important. Can you do finance? Can you negotiate? Communication and relationship management, of course, all of those people things that you need to do, build teams, create culture, and professional and social responsibility. How do we deliver for a system? Doesn't matter whether you're a Liberal or a Labor person. How do we develop for a system that meets the needs for public or for our stakeholders to deliver what they need and deliver it in the highest quality manner? And just to emphasise and labour my point just a little bit, here's the Health Manager Competency Framework. The domain is health and healthcare environment, and the second one I'll point you, no, the third one I'll point you to here is understands how the healthcare system works, understands and considers the impact of the wider system structure, of course, public, private, community, aged care, disability, primary care, general practice, how all those bits work together to improve healthcare, and the funding of those organisations at the unit level, at the organisation level, or even at the state level. You've got to work through all of that, and you'll come out with that when you a basic understand of all of that when you finish this program. So, to be able to continue on this program, to be able to participate for the entire program, you've got to have satisfactory performance. You've got to complete the Masters within 2 years. You've got to attend and contribute at the professional development days. Contribute's important. You meet people like myself at the professional development days. We'll ask you for insights and input. We'll ask you for your learnings. We want you to contribute. It gives you the opportunity to consolidate your learning. We want you to submit all the required reports and evaluations and complete a minimum of 21 months. So we're pragmatic. We're not hard. If you are coming to the end of the program, we realise that it's time to start applying for a job. If you're successful straight away and you get your first job and you have to give 4 weeks notice and leave, 21 months. But that's the way the program works. And of course, the most important thing, we want you to demonstrate an alignment with the code of conduct and core values of the college. And that is our competency standards and our capability standards are intertwined. So we want you to be professional, ethical managers. Nothing surprising about that. They align with a lot of other codes of conduct as well. So here we are, the program. Now, if you've just come on midway through me giving my big sell, the program, welcome. If you want to ask a question, look for the chat in the ribbon up or below, wherever it is sitting on your screen, and ask me a question. While you're thinking of those questions and typing it in, I am going to just ask you one more question. And my question is, what's your intention now? You've heard me talk a little bit about the program. I hope you've got another question for me. What are you going to do? You're going to apply this year? You're going to apply later? You're going to do a bit more reading on our website? Or have I really put you off? Have you decided that internship is not for me? This is something you can do anonymous. I can't see who puts this in. And if you say it's not for me, I'll just take it on the chin. All right, that's great. I'm really impressed. I'm really pleased that you're applying for internship this year, and that is all of you. So I'm really grateful that you've stayed here and listened to me. It hasn't been too long. It's only been 30 minutes, and that was my target. Look, if you're interested in management and you've got more questions, you've got the opportunity to talk to Dee. Dee is online, and I am going to take her off mute right now.
Thank you.
So she can add a little bit more and can answer some questions. Now, also, feel free, if you would like to, you can, and just so you can see, everyone wants to apply for the internship, and so thank you very much for doing that. You can also, if you're interested in management and you want to connect with me, you are more than welcome to. There is my email, and if you can take down my spelling or know who I am, connect with me on LinkedIn. I'm happy to give you individual insights into health service management in my career if that helps you out. I'm happy to give you my time to have a quick chat on Zoom or on the phone if you want to know how to prepare yourself for such a stressful thing as an interview. Equally and importantly, and I'll just go back to that last slide, Dee is the National Manager of the Education Programs for ACHSM, and her phone number is right there on the screen now, and there is her email. She will be able to give you the real detail, the hard facts, the how it's going to work, and what do I need to do? Am I eligible? Tips, if you like. So I encourage you to make contact with her if you have really good program detail questions that you would like to ask.
That's great. Thank you, Paul. Just also add, if sometimes you're kind of 98% sure, but there's just that lingering doubt, those are the ones that we're really happy to hear about, and either Paul or myself will be able to answer those for you. So we look forward to hearing from you.
Great, and thank you very much. It is now at the point where we are winding up. Sydney has gone to sleep, as you can see behind me, and I look forward to seeing your applications and hopefully meeting you all when you are successful on the Health Management Internship Program. So thank you all for joining.